Hello, everyone. This is Jonathan Edelheit, Editor-in-Chief of Benefits Live magazine, the Corporate Wellness magazine, and the Healthcare Reform magazine. I'm excited to bring you our presentation today that is sponsored by CVS Corporate Gift Card Program. And the title of today's presentation is Healthcare Reform's Impact on Wellness and How to Incentivize Employees to Engage in Healthy Behavior. We're really lucky today. We have some really amazing speakers who will be presenting on case studies on what their employers have actually done. So I will be presenting today on healthcare reform's impact on corporate wellness, and then we'll be shifting to our other panelists. I would like to welcome onto the call Vanessa Cullerton, Senior Manager of Employee Wellness for the Hillshire Brands Company. I'd also like to welcome our other panelist, Stacy Nelson, Manager of Health and Welfare for Sprint, and our final panelist, Edward Shulkin, President of Gift Card Partners. So we really have an amazing panel of industry professionals. We have a really great turnout, over 600 people on today's Corporate Wellness webinar, and I'm excited to let the presentation begin. This presentation is brought to you by the Corporate Health and Wellness Association, which is the first national nonprofit 501c6 made up of employers across the country focused on health and wellness. So to give you an update on where we are with PPACA and healthcare, I'm sure many of you know it's abbreviated as PPACA. It was signed into law in 2010. The Supreme Court upheld it June 28th, which is kind of a surprise, which was a big surprise to most employers and HR professionals. You know, some of the benefits, the basics of PPACA are people no longer can be denied insurance due to a pre-existing condition. I think this has made a lot of people happy in the wellness industry because there were a lot of people who had sicknesses who couldn't get care. Anyone, you know, not covered by an employer, Medicaid is required to purchase insurance or an exchange, which will be set up, or they're going to be required to pay a fine, which is called the individual mandate. If you aren't aware, a Deputy Commissioner of the Revenue Service actually came out and said that the IRS will not be auditing the individual mandate, nor will they actually to see who actually, if there's going to be an entity that actually claims and penalizes people if they have it, or it's going to be on the honor system. The insurance exchanges will be done on the state level, where we're on the state where individuals and small businesses can shop around for insurance. It's going to be rolled out first for individuals and eventually businesses. Some states have been fighting the rolling out of the health exchange, and there's some litigation going that may go up to the Supreme Court, whether states have to do an exchange. And in the meantime, the federal government is actually implementing a federal exchange for those states that don't want to offer it, that potentially individuals from those states or businesses could purchase it through the state exchange. It's a common, misunderstanding that insurance premium down because of a result of this law. I think that most people agree, both employee insurance companies, that the effect of insurance premiums are going to rise, and one of those reasons why they're potentially going to rise is that healthcare reform really wasn't reform of healthcare. It really created minimum loss ratios for carriers, but it didn't reform tort reform, medical malpractice, the cost of medical supplies and pharma, and some of those things that really are a major cost of insurance. And now that a deputy commissioner has come out and said that they're not going to enforce the mandate, which in 2014 was going to be $95 for the year, or a little under $8 a month, eventually going to $605, it's not that much of an incentive if someone's paying $500 to look for insurance to buy it. And now that they're not going to enforce the mandate, the mandate was a major part of why people were going to come onto insurance, have a risk, both healthy and sick and old, so there wouldn't be adverse. So now, while there's a very big positive of everyone can purchase starting January 2000 an important insurance without any pre-existing coverage, there is the potential that people will opt out of insurance and wait until they're sick and purchase insurance then. And if that does occur, you will have adverse selection, and premiums are going to go up for those people who decide to stay on insurance. for it in the meantime. So what does this mean for wellness? I think this is going to be really positive for wellness because since healthcare reform doesn't comprehensively reform healthcare, it's going to require a lot of industry, forcing employers, insurance companies, agents to look at what is innovative, what are they going to do to actually lower their healthcare costs. And I think wellness programs are one of the few answers to this, because people have tried the consumer-driven plans, the high-deductible plans, and not had the success that they really wanted to see, where, you know, everyone realizes now one of the big reasons healthcare costs are going up is people living unhealthy lives, conditions increasing, diabetes, heart disease, and that wellness programs could be the answer to get a healthier workforce. So what does this mean for wellness under PPACA? The government's establishing programs which will help companies establish wellness initiatives. The program will create tax incentives for employees who create and utilize wellness. And the federal reimbursement plan is an employee-based plan which directs that employers must implement a program to generate cost savings for employees with chronic or high-cost diseases. So this is a new approach, and it will require employers to approach their healthcare a little differently. And with increased premiums, it will make it more expensive for an employer offering their employees health insurance. Now, if we look at incentivizing employees, obviously any wellness program will be helpful, but if it's not going to be used if it's not effective. And there are ways to incentivize employee participation in wellness, such as cash incentives, rebates, gift cards. Gift cards, it's a growing trend. It has been around for years, but now this is becoming a major way employers reward or incentivize their employees, and they're really an effective means of getting employees to engage in wellness. And employee engagement is very important. You need incentives to get people to engage in healthy behavior. They're not necessarily going to do it on their own, and I know that one of the biggest challenges most employers have is, okay, we have a wellness program, we get the employees engaged in their own, get actually want to change and make changes in their lifestyles that will make them healthy, or if they're ill or sick, to adhere to medication or to what is needed to get better. So these incentives can also continue to boost participation in the wellness program. One company reported an increase in once they implemented wellness cards from 15 to 39%. Some companies tie giving gift cards to taking an initial health risk assessment or biometric screening as a way to get employees to participate in it. Also, there are things like living healthier, health coaching, using online tools, and tobacco cessation as ways to, give gift cards or participate in those types of programs. This is kind of an issue in the ROI. How do you other ways besides ROI? Employees participate, you're going to have zero ROI in the plan. If we look at realistic predictions, we're not going to see ROI in the first couple. This requires an investment in the plan, and some employers have seen ROI in the first year, but a lot have said that you're going to start seeing ROI come into play in the second year and definitely in the fourth and fifth year. So this is a long-term investment. National Institute of Healthcare Reform reported an average an ROI of 3.27, 2.37 to 1 reduced in absenteeism costs being reduced. To do everything right, the hard return on investment ranged between 0.25 to 1 and 4 to 1. Hasn't been a tremendous amount of detailed research, especially in the recent, past, over a large base of employers to really measure the ROI. So, why are gifts, important? CVS Select Card. And while we're mentioning the CVS Select Card, I'd like to thank CVS for gift cards, for their sponsorship of this program and allowing it to come together. It doesn't work, if you have a gift card, you can't use it when buying cigarettes, alcohol, and candy. For those who are aware of using gift cards or even healthcare credit cards within their health plan, you can actually limit it down to a T, a dot, specific stores, and within those stores you can have it for only a certain amount of items based upon codes can be purchased, or you can allow anything but eliminate certain codes. So you can have it just for healthy items. Used at Subway, not that I'm advertising Subway, but if an employer felt that that was a healthy food option, they could give that out to their employees. So if we continue with why gift cards are good for wellness programs, is it still gives the employees incentives without the problems that cash can bring. Employees won't feel bad about receiving a gift card with $10 value, where if you gave an employee $10 in cash, they might feel somewhat slighted from it. If we look at manufacturing, in manufacturing jobs, gift card incentives are used really to motivate employees to engage in safer behaviors. That's been happening for a while as a reward. And if it's done systematically with proper measurement methods and you create a culture of preventing accidents, the company's going to realize an ROI and increased productivity, reduced healthcare premiums, and potentially reduced worker comp claims. If we look at unsafe workplaces in this context, the National reported that 3.8 million annual workplace injuries took place in the U.S., 90% of which caused permanent damage. The average cost per injury is 28, which was for a grand total of $130 billion nationally. So to look at another manufacturing incentive example, if a company played it, safety bingo once a month, and there hasn't been an accident in the past 15 years, they could go away and give gift cards to their employees. The company also rewards employees who they see using the personal protective equipment in the proper manner. And some look at occupational health and safety as a part and sometimes falling under wellness. If we look at gift cards in nonprofits, many times when one thinks of gift cards and nonprofit organizations, they use them for fundraising. They script what's called sell cards to companies in order to fundraise. Now that really isn't focusing on wellness, but we're just giving different examples of gift cards. There's a lot of different applications. You can get as creative as you want in the workplace with them, and that's just, gift cards are just one incentive. There's a lot of different ways to incentivize employees, as I'm sure our panelists will go into. And obviously, some for-profit companies use gift cards to attract talent and increase productivity and hit goals. If we look at gift cards in healthcare, they're used internally with employees and externally with patients to drive desired long-term goals. And they're definitely involved in health and wellness, and they're the second largest category of gift cards is the health and wellness space behind general rewards that employers give to their employees. So it's a really huge market, the health and wellness gift card market. Rewards are also given out as a system for activities like joining a gym, reaching a milestone in weight loss, lowering blood pressure, and taking a walk during a break. And as healthcare continues to rise, we're going to see more and more employers implementing these incentives. There's been some recent surveys and research from Towers Watson and some other big like Deloitte, that employers are going to continue to invest more than more than they have before, and more employers are going to be implementing wellness in the workplace than they've done before. I'll give you some examples of gift cards in the healthcare setting. An infection control department in Mississippi rewarding employees who are always washing their hands. A medical school in California that conducts patient surveys, and the person who conducts the most surveys gets a gift card every 3 months. So this is very easy in the wellness space. The person who walks the most gets a gift card, who loses the most weight. The sky is the limit in what you can actually do. For self-insured companies, by using incentives to cut medical expenses and incentivize their health and wellness, some have been able to fight the 8 to 10% inflation rate we've been seeing, and some have been able to reduce their claims by about 3%. One Pennsylvania health insurance provider offered group customers investment rewards to get employees active in their health and wellness. And if we look at examples of what happens in the utility and energy industry, customers get gift cards if they switch a utility company or by cell phone company. So I think that, one of the reasons I'm going into some of these examples that that aren't health and wellness related is that our society and individuals are used to being incentivized and used to be getting gift cards. I'm sure many of you, use Amazon. Amazon's very creative, and they give gift cards out to people who use their service a lot. So it's a great way to build loyalty and get people to keep participating in the activities that you would like. So, at conclusion, in the difficult economic times that we're in, the use of gift cards is really beneficial for employees. It really increases their motivation, appreciation. It provides a bonus to the employees that they otherwise wouldn't get, that they're going to appreciate a lot more because of the economy that we're in. It increases the productivity, and it really helps the business continue to grow. And companies who use gift cards as incentives are getting, the benefit of reducing costs as a healthier workforce. So that before, our next panelist is going to be Vanessa Cullerton, but before we go into that, we're going to do a quick survey of all the participants. It'll be about 15 seconds. So if everyone can, look at their screen and answer our survey. We just want a moment or two more to fill out their answers. So the question was, do you provide incentives to employees only or employees and dependents? And the answer is 43% of our respondents said they provided to employees only, and 57% says current offer incentives, and 0% of respondents said that they offer it to both employees and dependents. So I'd like to thank everyone for filling out our survey. And with that, I would like to introduce our next speaker, Vanessa Cullerton, and she will be presenting on behalf of Hillshire Brands. So with that, I'll turn it over to Vanessa.
Thank you, Jonathan. I put one of the slides here. Thank you. To give you a little bit of information on Hillshire Brands, in June of this year, we became our own public company. We were previously known as Sara Lee, National Coffee and Tea Business. We are a $4 billion company with iconic brands, and you can see just some of the more well-known brands that we are known for. We have approximately 9,500 employees with manufacturing locations throughout the U.S. We are headquartered in Downers Grove, Illinois, but we're actually going to be relocating our headquarters to Chicago in the next couple of months. In health analysis, and that actually caused us to relaunch our wellness program. And we had 5 key findings within the health risks. What we found was, of the 5 findings, we had a high cost for our chronic diseases. We found over 20% of our population actually had no claims. We're not going to the doctor and even having preventative exams. We did find that our spouses are higher risk and have no claims, and that there are geographical differences and behaviors that are leading to higher healthcare costs. And really focused our health risks in 5 key areas: obesity, high blood pressure, smoking, stress, and alcohol. So with this information, we relaunched our wellness program in July of 2011 and really split this into 3 phases. Our first phase was centered very much on the knowing your numbers, so having your biometric screening, completing a health assessment, and creating a personal profile. Phase 2 was focused on providing a health map for our employees and our enrolled spouses, and recommending programs and care based upon their health map for themselves. And then phase 3 was more on online tools, managing your health visits, and how to earn incentives. After just 1 year, we did have some great traction. 50% of our employees either attended a health screening or completed their health assessment. That was a really big stride for us because prior to that, we had less than 5% participation by our employees. 35% of the employees that did their health assessment actually then completed or enrolled in a program, and those were telephonic programs where you would speak to a coach, an online program which could be something that you followed or even did your physical activity tracking online as well. We also visited all of our locations with employees that had more than 50 employees that were there. Our participation was fantastic at the events. We had actually almost 70% at 2 of our locations, so we were really proud. This was with incentives tied to it, but there was no requirements. It was all voluntary to participate in the program. The first, and we also launched a challenge. It was our New Year, New You challenge in January. And that first challenge we were very excited about the participation. Those that participated tracked over 6 hours of physical activity and on average lost 1 pound per week. And actually our winning team lost an average of 25 pounds, and they actually did a really great job of keeping that up and had their own competitions and are still losing to this day, actually. So I wanted to get into a little bit of what was different with this relaunch versus what we had prior to launching the program. The first was we brought in a new vendor, Red Brick Health. We really rebranded the program and took away some of the concerns that were there previously. We eliminated the big brother mentality. Our previous vendor was tied to our insurance, so there was some concern for those participating of whether while there was privacy, there was just the mentality of was it being shared and how was the insurance company using the information. We also took a grassroots communication approach and implemented location champions. We had 5 champions in each of the locations, a minimum of 5, and never turned any away if there were more than that were interested in promoting the program. And we also moved away from premium discounts and introduced gift cards. While we kept the incentive amounts the same, the employees really valued the immediate reward of the gift cards. And actually, some of the feedback that we received was that the premium discounts didn't really feel like it was an incentive. It was prorated throughout the year, and typically when you received your first premium reduction, it was also at the same time that the premiums were increasing. So if you received that in January, that was also when the premium increase was coming. So it never really felt like a premium reduction. Some of the things that we have coming in the future are focusing on our communication efforts. We've done quite a bit around the communication, but know that enhancing our program from a spousal perspective is key for us. We've focused very much in the first year on getting our employees to participate, but knowing that we have a high-risk population with our spouses, we absolutely want to continue that and focus on getting them more and more involved. We're also looking at considerations for 2014 and beyond, looking at results-based measurement factors using surcharges or possible incentives for value-based design and programs, potentially looking at more of a stick approach to your more traditional carrot approach, or doing a combination of the two for that. And with that, I will hand it back over.
Thank you, Vanessa. I would like to now introduce our next panelist. And by the way, if people have questions, they can ask questions during the presentation. We'll be answering them afterwards, and also get an opportunity to email questions in later. But I'd like to now introduce our next panelist, which is Stacy Nelson, Manager of Health and Welfare with Sprint.
Thank you very much. All right, well-being at Sprint. We've been taking a little different approach as well, going beyond just talking about wellness, about looking at the total well-being, and something that we started championing this year. So really, it's beyond personal health. It's helping our employees thrive as well as their family members. So a little bit about Sprint, and this also helps us kind of define, how we develop our well-being initiative as well. As, we look at our culture today as being high-performing and inclusive and thriving on innovation. In order to do that, that helps us, provide a range of wireless and wireline communication services, providing mobility for our consumers, businesses, and government users. So again, we have very tech-savvy employees and high-stress jobs, and we have to kind of figure out from a well-being perspective how to kind of balance all of that for them. So our approach for 2012, we went from a wellness strategy to creating our culture of health, or our total well-being. So we evaluated, how we were doing our communications, what our programs were like, and what our participation and engagement and completion of our programs on our current wellness program that we have today. So we looked at, we needed to shift from our physical wellness to overall well-being. And we looked at these different pillars, from physical, financial, community, social, emotional, and career. And some of that is outside of what my programs that I support today, so we really overlap some other programs within Sprint to make sure that our employees and their families understand how these may complement if they're having some physical concerns that may also impact their financial, or how they're dealing with employees or other family members from a social perspective. So we wanted to make sure that they understood what is completely available to them, not just from a physical perspective, which in the past we had emphasized a lot. Ultimately, we wanted to fully engage our employees and families to understand all aspects of the well-being, as also look at, finally, to focus on membership. What is our baseline? How are we trending? And how do we continue to develop the programs and initiatives we have today? So the incentive strategy of creating this thriving culture at Sprint, we take a multi-tiered approach for our various well-being programs that include the following. So we don't have just one thing that we have seen that works completely across the board. So as we look at the various initiatives that we have done, and I'll provide two examples that we have done this year as just an example of this multi-tier approach. But one of those is points that our employees can earn via our recognition portal. So as they earn points for completing programs, they can take those points to purchase information, gift cards, or T-shirts, Sprint merchandise, CDs, fitness stuff from our recognition portal, stuff that is of interest to them. And so they can take those points and apply that for what they are looking at. And we also, the other thing that we have to evaluate from an incentive perspective is taxation. And we typically gross those up in many of our programs, but ultimately if they are responsible, we do communicate that as well. We do have donation from our Sprint vendor partners for gift cards for many of our programs, whether it's for health fairs or wellness challenges or for other things. So we look to our vendor partners as well to support our concept of total well-being here at Sprint and to partner with us with those initiatives. And also in some instances as well, we will provide gift cards as well as part of programs, or ultimately they can purchase those with their points through our recognition portal. One of our largest initiatives is our premium discounts, and I know Hillshire had spoke about they were kind of phasing away from that. That's still a big incentive for Sprint. We call it our healthy living discount, where they have to be in a tobacco-free household, as well as the employee needs to take the health assessment in order to receive reduced premiums for medical and prescription drug programs each year. We also have incentives for those for diabetes programs for some of our medical plans, where if they complete certain goals, we will provide funding into their health reimbursement accounts. We also provide donations, contributions to various Sprint charities as part of our wellness initiatives as well. Donation of Sprint product and services, such as phones. We have some kids sneakers, so things our employees can relate to as part of our strategy as well. And then we have on-site initiatives. We also have we have wellness committees at many of our call centers today, as well as wellness efforts on site, which definitely helps us communicate and advocate on this culture of health that we're trying to accomplish. Sorry. So one of the new services that we rolled out this year, because we kept thinking, how can we create a personal approach for employees and their families? We have disease management, health improvement programs, a robust portal, we have our EAP, so we have all these great programs and okay engagement. So we thought, what can we do? So we piloted 2 of our call centers on what we call a health advocate, where we personally assigned a health advocate with our vendor, Optum, in this new kind of concierge health and well-being model, and rolled out saying, we sent out this email and said, this is your health advocate, call them today to get engaged. So we ran this pilot last year, and then this summer we rolled it out nationally. From July 17th through September 18th to all our employees. So we send an email as well as a home mailing. So not only do we touch our employee, but we touch the household as well. So we really wanted to kind of create a personal approach. And as part of this national rollout of kind of transforming this to this health advocate model, we piloted incentives from gift cards. So some of the communications we promoted, if you call today, you would be eligible to receive a Starbucks $5 gift card. Some of our communications did not include that incentive, so we could kind of see what works and what does not. And then also they are entered into to potentially win a Sprint tablet as well as another opportunity to incent employees. So ultimately we want them to call. We are still kind of working through did the incentives make them call, since we just kind of finished the rollout, that we still probably will take a few more months to kind of see what that engagement is like. But I have some initial statistics I wanted to share with you thus far. As I said, every employee received a personalized email as well as a home mailing. Some of our employees received the gift card to Starbucks and a chance to win a tablet. But the ultimate benefit is the opportunity to work with this personalized health advocate. So some of our statistics that we have seen so far is our launch emails. The first email that we had sent to them, we also have a lot of follow-ups as well, whether someone does call or does not call, is we have an open rate of 31.6%, which is above benchmark for what I typically see with email communications. And then reminder emails, we're seeing about 24.7%, and second reminder emails about 19%. So we continue to run a little bit, but to date, we have about 39,000 employees today. We have a little over 1,093 enrollments to date. So 92% of our goal to date. We're hoping to get with this initial launch about 1,500 enrollments, which means calls into our advocate. And 370 individuals have taken advantage of the incentives, the $5 Starbucks gift cards that were available by making that first step to make outreach to their personal advocate. And ultimately, as they talk to their personal advocate programs, whether it's online or telephonic, they have the opportunity to earn Sprint point size to our recognition portal that gives them an opportunity again to purchase gift cards or other services or merchandise. That's the recognition portal. One of our other initiatives that we had this year that we incorporated a multi-tier approach for incentives was our Sprint Get Fit Wellness Challenge. So I kind of talked about some of their kind of wellness challenge initiatives as well. This year we rolled out an 8-week physical activity challenge for all our employees. We had a 25% participant, which was about a little over 9,800 employees. We did offer this challenge last year as well, but it was a 12-week challenge, and 54% were repeat enrollees. We also had 18% of the participants in a high-risk category, and we had a 49% completion rate to track through the very last round of that challenge. We estimate to have about $969,000 in real-time value return on investment for kind of future claims that we will see in either terms of the weight loss that we saw or behavior change, reduction in cost savings from a cost perspective. We also have the opportunity to work with an e-commerce to get them engaged into our online and telephonic programs with the opportunity to earn e-points as well. Overall, we have great satisfaction program and completion rate for our wellness challenge. The that we saw was a loss of 21,597 pounds, about the weight of 2 elephants. Our employees walked, because they were in different categories, approximately the distance they were to the moon 5 times. Employees exercised for a total of minutes that would equal to 20 years. So we ultimately believe these behavior changes will continue outside of the wellness challenge that we provide to our employees each year. So from a multi-tiered approach, here are some of the rewards that we offer through our Get Fit Wellness Challenge. We provide incentives as part of the registration process, such as body media devices for different drawings to get people to register. And then once we start the challenge, we have the opportunity to do drawings each week for many of these prizes listed here, which includes gift cards and different Sprint devices, as well as other things donated from our vendor sponsors as well. And again, one of the big things we did this year as well is charitable contributions to Feeding America. But I think our whole focus is really about providing a blend of incentives to employees, because each individual may perceive a reward differently than someone else. So what's next? We want to continue to develop our personal approach and our health advocate, and that our Sprint Alive program is a trusted program among our employees and their dependents, and make sure we have resources that they understand and they utilize. We want to align our wellbeing strategy to the needs of the organization as it changes. We want to monitor and develop our incentive strategy to continue to engage employees and eligible dependents to have a more role in participating in completing programs for rewards, such as biometrics, having spouse and domestic partners take health assessments, create a point-based system. So creating greater accountability for a health focus than just taking a health assessment and having an action. We want them to take extra action and be rewarded with that. And also we see communication is really the key for us for our role in providing well-being programs here at Sprint, and that it is part of our strategic goals of providing a culture here at Sprint that's focused on health. So our goal here at Sprint is to make a healthy place, Sprint a healthy place work by aligning our vendor partners and continue to focus on well-being and creating the right incentive approach for employees and their dependents.
Thank you, Stacy. That was an excellent invitation. Definitely a lot of good information in there. Over our presentation to Edward Shulkin, President of Gift Card Partners.
I'd like to thank all of you particularly for joining and attending today's presentation. Thank you, Jonathan, for moderating. Thank you, Vanessa and Stacy, for your valuable case study and employer insight and perspective. If any of you have additional questions or comments regarding the presentation you heard today, please send them to the contact email on the last PowerPoint slide.